To erase a wrinkle, fade a scar, or completely rejuvenate a face, the first step is always the same. You have to break the skin. Modern aesthetic medicine relies on a specific biological trade-off. To trigger profound healing, practitioners first have to cause intentional, highly controlled trauma. The physical objective is to bypass the body's natural armor. By disrupting the outermost layer of the skin, these procedures create thousands of microscopic pathways, or microchannels, straight into the living tissue below. This image illustrates the ways trauma is delivered. The needles of RF microneedling, the thermal columns of a CO2 laser, the light pulses of IPL, or a chemical peel. All are designed to penetrate the upper skin layers. Looking deeper reveals the immediate biological consequence. The skin enters a sudden wound state, losing its barrier protection and leaving the delicate internal tissue highly sensitive and exposed to external factors. This creates a critical window of vulnerability. The very mechanism required to rejuvenate the skin simultaneously leaves it defenseless. At this stage, the final clinical outcome is no longer determined in the chair. It depends on what happens next. While the procedure itself is precise, the recovery phase is often where the process fails. Data suggests that the majority of clinical complications do not happen during the treatment. They happen afterward, while the barrier is disrupted. Faced with thousands of open microchannels, the standard clinical response is to aggressively prevent infection. This leads to applying harsh antiseptics. These chemicals are frequently cytotoxic, meaning they can be toxic to the very cells trying to repair the damage. The second common protocol is to seal the wound immediately. Clinics frequently instruct patients to apply heavy, occlusive ointments. However, creating an airtight seal on a fresh injury can suffocate the disrupted barrier. Trapping a fresh thermal injury under a thick layer of ointment prevents the skin from cooling and shedding naturally. This often results in trapped heat, unexpected acne, the formation of milia, and exacerbated, uncontrolled inflammation. Traditional aftercare can inadvertently sabotage the healing process by either introducing cytotoxic chemicals or suffocating the tissue with occlusion. These protocols risk creating the exact complications the clinic is trying to avoid. This necessitates a shift in how we manage tissue repair. SilverStream is a hypertonic buffered solution, a liquid engineered to manage fluid dynamics and balance pH. Originally developed for severe surgical wounds, it is now being utilized to stabilize aesthetic recovery. To understand its effect, we have to look at the cellular battleground. Skin repair relies on two specific cells: keratinocytes, which scramble to close the microchannels in the epidermis, and fibroblasts, the deeper dermal cells responsible for rebuilding the skin's structure. Standard cytotoxic chemicals attack the cells trying to save the tissue, fracturing cell membranes and severely delaying healing. But SilverStream is non-cytotoxic. It washes over the area without damage, preserving cell viability so keratinocytes and fibroblasts can continue their normal repair unhindered. Keeping those dermal fibroblasts alive is essential. These cells are the biological engines that produce type 1 and type 3 collagen, the specific structural proteins required to rebuild firm, elastic skin after a controlled injury. Predictable, high-quality skin remodeling is only biologically possible when the post-treatment environment preserves rather than attacks cellular viability. Beyond cell preservation, the solution actively controls the wound interface. Even as a liquid, it functions with the moisture-retaining properties of a hydrogel. This creates a continuous, moist, and cooling layer over the inflamed tissue. This improves patient comfort without the heat-trapping occlusion of a heavy ointment, allowing the skin to breathe while it heals. While the tissue is protected, it also needs an active defense against infection. The formulation utilizes a precise, low-dose ionic silver at exactly 0.01% concentration. At this specific concentration, the silver is designed to destroy complex bacterial colonies, known as biofilms. It inhibits microbial growth without building resistance or causing tissue toxicity. The solution also provides mechanical cleansing. As it moves across the tissue, it clears cellular debris and reduces high levels of matrix metalloproteinases, or MMPs, enzymes that can cause excessive tissue breakdown if left unchecked. This synergistic formulation is designed to control the microbial load and limit aggressive inflammation, while maintaining the exact physiological moisture conditions required for tissue repair. In many clinics, the current standard of aftercare is fragmented. Patients are often handed a confusing mix of saline washes, ointments, and complex instructions, which increases the likelihood of improper care at home. Shifting to a single, multi-action solution simplifies this operational reality. It replaces conflicting steps with one comprehensive protocol used throughout the recovery cycle. This creates a seamless timeline. SilverStream is applied in the clinic the moment the procedure ends, and the patient continues the exact same protocol at home during the days and weeks of their recovery. Keeping the surface clean and hydrated supports natural sloughing without trauma. This accelerates reepithelialization, the process where the skin's barrier is restored, leading to a calmer and more consistent recovery. Standardizing the recovery phase with a medical-grade solution removes the variable of patient error. It ensures every skin type receives the same controlled environment needed for a predictable healing response. In aesthetic practice, the true measure of success isn't the immediate injury created in the chair, it is the quality of the final tissue remodeling. Managing the recovery phase with a controlled microenvironment helps prevent complications that threaten a clinic's reputation, such as severe infection, unexpected scarring, or delayed healing. This map shows the global regulatory footprint of SilverStream. Its safety profile and patent portfolio have led to its adoption across both civilian surgical centers and military medical units worldwide. By managing the vulnerable recovery phase with a controlled microenvironment, clinics provide the physiological stability necessary for successful healing. This systematic approach preserves the integrity of the procedure, reducing the likelihood of avoidable complications.